Professional English in Use, Chapter 6 and 7. Chapter 6, Medical Practitioners 2, Hospital Staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of four main groups. A pre-registration house officer, PRHO, or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor, FY1. A senior house officer, SHO, is the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FY2. But the old terms senior house officer and SHO are still used. A specialist register, SBR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. A consultant is a fully qualified specialist. There may also be some associate specialists, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all the medical staff. Medical teams, consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors, but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clears them, takes their medical history, and examines them sometime later. The registrar also sees the patient and may order investigation or tests, for example, X-rays or an ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patient is discussed with the registrar, consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. Shift. Junior doctors now normally work in shift, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, available to return to the hospital if necessary. From 5 p.m. to 9 p.m. the next day. Days on call are set up in a rota or list of names and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. Exercises. Exercise 6.1. Make word combination using a word from each box. Look at A, B, and C opposite to help you. Associate specialist, house officer, on call, provisional diagnosis, radio pager, and ward round. 6.2. Match the description with the job titles. Look at A and B opposite to help you. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to ward 60. Dr. Stewart has just started the second year on her foundation program. Dr. Sai has started his training as a surgeon. Dr. Phyllis has just graduated and is working in a large hospital in Birmingham. Dr. Miller is a charge of the medical staff in the Birmingham hospital. The number 1 is C, the number 2 is D, number 3 is A, number 4 is E, and number 5 is B. Exercise 6.3. Are the following statements true or false? Find reasons for your answers in A, B, and O, and C opposite. A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in Britain is called the Foundation Program. True. The name senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patients. False. When working in shift, all doctors take turns to be on call. True. 6.4. Complete the test of a PRHO describing her job. Look at A, B, and C opposite to help you. When I get to the work, the first thing I do is talk the house officer who has on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clear any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms for blood tests, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They're usually happy to be gone home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. And